Veterans reentering civilian life face many challenges, including finding a job. Hi, I'm Montel Williams. Welcome to this episode of Military Makeover Operation Career. Today, inspirational stories of former servicemen and women who have reinvented themselves and are thriving at companies who value their unique skills. For our heroes that are currently serving and those who have retired, healthcare is a top priority. But thankfully, there are companies like Potomac Healthcare Solutions who not only provide high-quality healthcare for uniformed service members, they provide a career for military personnel and their families.
I was enlisted in the Navy in 1967, so Vietnam era. Became a hospital corpsman, worked primarily as a surgical tech for a number of years, and then eventually was advanced to the rank of chief hospital corpsman, and then eventually commissioned as a medical service corps officer. I served 23 years in total.
Well, interestingly enough, I joined the military when I was a junior in high school. I joined the Navy Reserves in Chicago because it was cool to wear a little white uniform and walk in downtown Chicago. I served as an enlisted hospital corpsman, working both in aerospace physiology and as an independent duty corpsman, which meant that I could go aboard a ship with 150 people with no physician and nobody else, and responsible for all of their health care, sanitation, preventive medicine, the whole bit. It was our responsibility, and spent the next 22 years as Medical Service Corps officer, and I retired as the commanding officer of the Naval Medical Clinics Command here in Washington, D.C.
Potomac Healthcare Solutions primarily serves government agencies both domestically and internationally with their healthcare needs.
Well, Potomac Healthcare Solutions was formed in 2011 after my partner, Bill Joseph, and I had both worked together at some other government healthcare contracting companies. We basically formed the company to serve DoD, either in staffing of military facilities and or standing up and operating freestanding primary care centers. Since then, we have evolved into a much larger and much more capable company. Our suite of services is fairly broad. We provide simple staffing, which could include just one healthcare worker at one facility, ranging up to several hundred people. We support hospitals, medical centers, clinics, freestanding areas such as VA services, but we primarily kind of pride ourselves in finding a solution to the government's need and fulfilling that by identifying, locating, and recruiting the healthcare workers and then employing them.
So many of our veterans are forgotten. While they're on active duty, people think about them and, rally and wave the flag and everything else. Then when they're out of service, they're forgotten. And the worst thing that a veteran can have is someone who won't listen to them. They have stories, some of them not so good, but they just want to be heard, and providing health care to them is a way to help them not only with their physical health care, but with their mental health care, and to provide them an outlet and somebody to deal with. We think veterans and hiring veterans and their families is significantly important because they've been there and done that. They have a more intense relationship and the ability to relate to a specific issue than someone who's just off the street. Doesn't mean that the quality of health care is any less from somebody who's not been associated with the military, but the empathy and the understanding of the current issues and how they impact them is a little bit more easily identified when you're dealing with someone who's experienced it yourself.
At the end of the day, it's all about serving the patient's needs and doing whatever we have to by either adding additional staff, adding specialized equipment, and establishing relationships for referrals.
To learn more about their services and their mission, visit PotomacHealthcare.com.